Hi, I'm Melissa Dees. This is my speech on the alternatives to animal testing. We've all seen the movies where activists break into a laboratory and liberate the animals from their cages, freeing them from a life of pain and fear where they were used for the betterment in experiments for the benefit of mankind. Now, I'm not suggesting that we all run out and do anything illegal like that. However, polls show that most Americans don't like the idea of testing on animals. A recent Humane Society of the United States poll showed that 67% of Americans oppose animal testing. Maybe we have the opportunity to be the generation that stops animal testing once and for all. Maybe we can push for changes and get the U.S. companies to use some of the new, safer, better ways to test our products than on animals. Maybe we can bring the U.S. up to the level of over 30 other countries in the world that have already made the change. For years, animal testing was the only acceptable method for testing medicines, chemicals, and cosmetics for human use. Until recently, we really didn't have any viable alternatives that would allow us to ensure the safety and efficacy of the products so they could be sold to the public. However, current technology offers us new and exciting ideas now that weren't available in the past. I will be introducing some of this amazing technology to you later. Animal testing has been recorded as far back as 500 BC when physicians like Aristotle performed experiments on animals to discover the internal functions of living beings. During this time, animals were not believed to have intelligence or deserve the same justice as human beings. It was believed that they couldn't think or experience common pain. In 1876, Queen Victoria became an opponent of animal testing and helped to pass one of the first laws regarding animal testing, Great Britain's Cruelty to Animals Act of 1876. Now, countries around the world, the 27 countries of the European Union, India, Norway, and Israel have banned animal testing and the important sale of products from other countries that contain ingredients that have been tested on animals. The U.S. has not made any laws against animal testing. However, there are nearly 50 different alternative testing methods that have been developed and validated and are already in use internationally, so it should only be a matter of time before the U.S. gets on board. In fact, in 2015, H.R. 2858, the Humane Cosmetics Act, was introduced and would align U.S. laws with those of the European Union. There are many organizations in the U.S. that are working to combat animal testing. These include PETA, the People for the Ethical Treatment of Animals, the ASPCA, or the American Society for the Prevention of Cruelty to Animals, and the HSUS, the Humane Society of the United States. There are U.S. laws on the books to protect certain animals in laboratories, including the Animal Welfare Act and the Public Health Service Policy. And there are several programs requiring federal agencies to support the development of alternative tests. Contrary to popular belief, the FDA does not require animal testing. And to correct another myth, the animals being tested on are not just mice and rats. They are dogs, cats, chimpanzees, and rabbits. According to PETA, over 1 million animals were used in U.S. labs in 2014, and only 5% of those animals were covered under the Animal Welfare Act. These are the lives of living, breathing animals that are at stake. There are many alternatives available now that make animal testing almost obsolete. Technology has come so far that there are not only computer-aided alternatives, but some in vitro methods as well. Not to mention that animal testing has some drawbacks in its usefulness. There are many reasons why animals just don't work when testing things for human use. It's also a lot cheaper to use alternatives, and with a growing number of already approved ingredients, it is possible that testing may not even be necessary. Some of the excuses for why people think that we need to continue with animal testing: one is every medical breakthrough and advance we've discovered in the past is directly due to the animal testing that was done. We never would have the medications and vaccines we have now if it were not for animal testing. Yes, it is important to acknowledge the vast amount of medical breakthroughs that have come about in the past 100 years, many of which went through animal testing before being approved for human use, an example of which is the polio vaccine. However, by the same token, there have been many catastrophes as the direct result of animal testing. One example of a catastrophe is the medicine Vioxx, which was released by Merck in 1999 to treat acute pain and arthritis. During testing in animals, the medication appeared to provide a protective effect on the hearts of mice. But in humans, it was a deadly drug, causing heart attacks and sudden cardiac deaths. Vioxx had been tested as safe in as many as 8 studies using African green monkeys as well as 5 other animals. It ended up killing 600,000 Americans and 140,000 people worldwide. Animals are not humans. We have different anatomic, molecular, and cellular systems. Some chemicals that are harmful to animals are actually valuable to humans. For example, many animals cannot break down aspirin, and a single dose could be fatal to them. Humans do not have that problem, and aspirin has long been one of the most popular drugs on the market. An alarming 92% of drugs that are deemed safe in animal trials fail when used in human clinical trials. On the flip side, a drug called FK506, which is a drug used to lower the risk of rejection in organ transplant patients, failed clinical trials and may have ended up not ever being released. Researchers stated it was too toxic to go to clinical trial. However, this life-saving drug was released and it works on humans. Another reason to not do, that people will use to not change from animal testing is, if we didn't have animal testing available to us, we would have to test all new products on humans. Well, all drugs have to be tested on humans. Once they pass animal testing, they then are tested on humans in clinical trials before being released. Despite the huge amount of animal testing being done on medication, adverse reactions from medicines are not being avoided. In fact, prescription medications account for the deaths of 100,000 people in the U.S. a year. Another fact to consider is that some diseases are unique within species. Not every disease humans can get occurs in other species, and the diseases that we do share don't necessarily have the same effect on humans as they do on animals. For example, AIDS originated in chimpanzees in Africa. However, their version of the virus is known as SIV, or simian immunodeficiency virus. When it was first transmitted to humans from the blood of the chimpanzees, it mutated into the virus known as HIV, or human immunodeficiency virus. Monkeys, however, do not develop the full-blown disease of AIDS from their version of the virus. So in order to test any possible AIDS vaccines on monkeys, the researchers have to give monkeys immune suppressant medications and then inject them with HIV and hope that they will develop AIDS in order to test any AIDS vaccine on them. You also have to take into account the different reactions to medications that will happen between species. When testing a new drug, we have no way of knowing for sure that the reaction the animal experiences or doesn't experience will be the same as when that drug is used in humans. That is why all drugs have to go through human clinical testing. Another argument would be that finding new ways to test things is going to cost businesses and taxpayers too much money. Well, animal testing is expensive. Animal testing can take years and hundreds of thousands of dollars to complete. More than $16 billion is spent by the U.S. government on animal testing a year. The same test could be performed using alternative methods for a lot less money. Here are some examples of the costs involved. The phototoxicity test using a rat would be $11,500. On a non-animal test, it would only cost $1,300. The skin sensitization test using a guinea pig is $6,000. Without an animal would be $3,000. And a skin corrosion test using a rabbit would be $1,800. Without an animal would be $500 to $850. There aren't any other testing options that give us the same knowledge as animal research does, would be another argument. Now, we know that animal testing is ineffective, costly, and potentially dangerous. But what other options are there? In vitro testing, or in glass, is what in vitro means, is a type of testing that involves cells and tissues. The items are grown in laboratories or in test tubes from cells and tissues cultured from human volunteers. An example of an in vitro test would be the Organs on Chips, which was founded by Harvard's Wyss Institute. These contain human cells and they mimic the functions of human organs and organ systems. These chips are already being turned into products that researchers can use in place of animals. They can be used to test drugs, perform disease research, and toxicity testing. They actually have been shown to mimic human response more accurately than human testing. This is the process. This is basically what a lung organ on a chip would be, and this is what the chips actually look like. Another type of in vitro test are the Mattex Epiderm. This is a three-dimensional skin model derived from skin cells, human skin cells, and replicates human skin. It can be used to test a substance's potential for allergy on human skin. This item replaces the need to use guinea pigs or mice. When guinea pigs or mice are used, their hair is all shaved off and then the substance is rubbed into their skin to see if it elicits a reaction. This has the epidermis and the dermis of the skin, and they would put the medication in it, and it would, or the chemical in it, and it would show you if there was a reaction. These are the little test tubes containing the substance. There is also in silico modeling, which is a type of testing that involves computer models of human systems. Computer-based techniques are highly sophisticated and accurate. They can predict how drugs will react in human bodies and can gauge the likelihood of substances being toxic to humans based on knowledge of human biology and the similarity of the substances to other known substances that we have out there. Epidemiological studies. Researchers study naturally occurring diseases rather than those that they give to the animals in the lab, like the AIDS, and study the data in order to understand the causes, treatments, and preventions of the diseases. One success from this type of research is the finding that smoking caused lung cancer. And there's also the reliance on previous research. There are ingredients that are considered GRAS, generally recognized as safe. They are well known, and in addition to these, the European Union has a database of over 20,000 ingredients that have all data available and no testing is needed. And these are just a few of the alternative options. So animal testing is ineffective. Animals are not humans, and we will not get the same diseases. We do not have the same reactions to chemicals or medications that humans do. Even after animal testing, all drugs have to be tested on humans in clinical trials, and it is very often found that the results between these two tests are extremely different. Animal testing is expensive, and amazing technology exists that makes animal testing obsolete. These are in use in 30 countries around the world that have already banned animal testing. Animal testing, besides being archaic and inhumane, is expensive and really doesn't provide the best use of public funds. There are so many better alternatives out there that we should be using. Italy, France, Germany, Norway, Israel, India, the UK, all of these countries and more have banned animal testing. If you are interested, please visit www.humanesociety.org and sign the petition to end animal testing in the U.S. Sorry, that wasn't very good.